Hi guys, I'm Renee. I'm an epilepsy warrior from WA. Today I'm going to talk about epilepsy and girls. Epilem, and girls. Here it is here. Probably can't see it, it's backwards, coming up backwards. Sodium valproate, or Epilem as they call it. Now, I was put on Epilem when I was 14 years old. That was the first medication they tried. And obviously, it was horrible. And they tried me on Tegretol, Lamictal, and finally on Keppra. But I have had to stay on this drug since I was 14. They cannot get me off it. When we were trying to get my seizures under control so then I could have children, they had to keep trying to reduce it. We got it down to 200 milligrams. I take one at night, one tablet of these a night. The other I take 3,000 milligrams of Keppra. Every time I went 2 months without it, I ended up having a seizure. So in the end, the doctor decided that I was on a small enough dose that it was safe for me to have children. And thankfully I got my 2 girls and there was no problems. Touch wood, inshallah. But and now that they're finally putting on it that you can't take it if you want to have children, they're still putting kids, especially girls, on Epilem. And as I say to you, the goal is to get people have their seizures under control. And you don't have to muck around with medication every time. So what I recommend is if you're a doctor and you have a daughter and they're talking about putting them on Epilem, I would ask for something else. I don't know why they're still giving it to girls. I don't think they should be giving it to girls because at the end of the day, you don't know what's going to happen. Maybe they'll get married at 21 and they want to have a child. But then they're going to have to delay because they're trying to get this under control. You want to find straight away the medication that works for you and you don't want to have to muck around with it. It took me a long time. I was 36 when I had my daughter. It took me that many years to get my seizures under control with the right medication. Now, if I had started that from day one and probably not all the stupid teenage shit that I went through, then I could have had kids a lot earlier. And I wouldn't have had to go through the pain of watching all my friends have kids. So what I recommend is talk to your doctor always, but if they're suggesting Epilem for a daughter, I suggest you ask for something different. Keppra is horrible with the side effects, but to be honest, I am 5 years seizure free on it. I was having 3 seizures a month before I went on to Keppra. And once I went on Keppra now, 5 years seizure free. Before that, I was 4 years seizure free. Before that, I was 4 years seizure free. So I think Keppra is the best, even though it has horrible side effects. One day, hopefully, they'll come up with something better. Inshallah. Touch wood. But I don't know why they're still giving it out to girls. I think Epilem is not good for girls at all. There also is a lot of things that it does to your organs, which is not so good. So if you have a daughter, I know it doesn't matter the age. I mean, if you have to use it, you have to use it. If nothing else is going to work. But I suggest it as a last resort. Epilem is a last resort. Speak with your doctor, because if you have a teenager, you can't have a baby on Epilem. So make sure they're on the pill as well. But always check with your doctor. But Epilem is a no-go for pregnancy, no-go for children. It causes birth defects. It's not worth the risk. So, as always, take care, stay seizure safe. Bye.